So for our group systematic review, we did it on an article that involved incidence, prevalence, and risk factors for elbow and shoulder overuse injuries in youth athletes. And this was a systematic review. So the whole entire purpose of this systematic review was to prevent sport-specific injuries in younger athletes. This is mostly pertaining to shoulder and elbow injuries. So there were a total of 36 studies done. Most of these overuse injuries came from sports such as tennis, baseball, and softball. Others including basketball, handball, and volleyball. But as you can see, they are a lot more prevalent in the sports in which throwing or the use of swinging your arm is involved. So the risk factors for pain include the position, the throwing technique, the intensity, and the duration of training. So position and throwing technique, that could be from a wrong throwing technique or a technique in which you are more at risk to hurting yourself instead of doing it safely and possibly not optimally. The intensity matters because if you are going at a hardcore pace all the time, you're never resting, you're a lot more likely to reach this overuse threshold before you can fully heal up and recover by your next training session. And the duration of training matters kind of hand in hand with intensity, because if you take the full length of a training session, however, some people's training sessions, if you're training for 5 hours, this will reach that threshold a lot faster than if you're training maybe for an hour and a half or 2 hours, especially during the week if you're hitting multiple sessions a week or even a day. So for preventative measures, the pitch count matters. They have a daily restriction on pitch count. This is very common in baseball, where they don't want them to overthrow too many times a day, although it might be practice. A lot of people think more practice, the better. However, this isn't always the case because this could lead to injury, especially as we saw for the risk factors, the intensity and the duration of training. And so we want to be aware of these risk factors for pain. So for my peer-reviewed article, I ended up doing an article on exceeding pitch count recommendations in Little League Baseball increases the chance of requiring Tommy John surgery as a professional baseball pitcher. Now, the purpose of this was to find the percentage of Little League World Series players who went pro, whether this is major or minor league. And they determined the rate of UCLR, which is ulnar collateral ligament reconstruction, in Little League World Series pitchers who went pro. So the risk of those who exceeded the recommended daily pitch count while playing in the Little League World Series, that was the purpose of this study. So Little League World Series pitchers were tracked from the years 2001 to 2009. This is from all sorts of teams and countries. So they had 638 pitchers total, 10% going on to be pros, 45% pitched in a minor league, and 50% were in the major league. So who required UCLR surgery? Well, 33% in the major league and 8% in the minor league. This could be because the major league has a much more hard or duration-based practices. They are not necessarily always training harder, but they might be training more frequently. So this might be the case for those. And for people who went on to play different positions other than pitcher, did not suffer from UCLR. In fact, 1.7%, 1.7% did not exceed the pitch count recommendations for UCLR. So as we can see, just the overuse and the constant use of throwing requires this reconstruction. So in conclusion, they found that it was, first of all, very uncommon to go pro. And then they found that those who changed positions were ultimately saved from UCLR. And this is important because obviously pitchers are probably throwing the ball a lot more than someone, let's say, on third base would be. So pitch limit regulations have been proven to protect against UCLR. They do have a daily amount in which should be practiced for whatever threshold they decided to go for. And for my lay article, this was actually an article that kind of just describes what to expect for when you need Tommy John surgery, especially for athletes. And this was a blog article written by a doctor, actually. So it seems to be a rather credible source of information, even for a lay article, which is nice to see. So what is it and who gets it? Well, as we saw in the previous slide, this procedure is to replace ulnar collateral ligament, uh, which is located in the medial elbow. So athletes who throw hard and often will likely be suffering from this. So preparing for the surgery. Well, you want to have meals prepared ahead of time, and you want to be ready for general anesthesia, which will be approximately for 1 hour. You also want to discontinue blood thinning medications such as aspirin and then even smoking. So the surgery consists of 2 incisions, one in your forearm and one in your leg. This is to replace part of the tendon in the forearm with part of the tendon in the leg. So the holes are made into the bones that your UCL is attached to. And then they thread this piece of living tissue through the holes and secure with anchors, sutures, screws, whatever they deem necessary. As far as the recovery goes, the elbow brace you wear a elbow brace for about 1 month, and you'll gain your full range of motion back in approximately 6 weeks. The return time to your activities is approximately 1 whole year. Athletes will need a much longer time to recover than non-athletes because the high stresses of throwing is a lot more damaging than possibly the average person who just happened to need this similar surgery.